Venipuncture is the insertion of a needle into a vein. Here we will review venipuncture for the purpose of collecting a blood sample into an evacuated blood collection tube, although it can also be done with a needle and a syringe. Most often assessed for blood sampling is the median cubital vein at the antecubital fossa, the inside surface of the forearm at the level of the elbow. Other good choices are the other veins of the forearm, such as the basilic and the cephalic, and those assessed from the dorsum of the hand, such as the metacarpal veins. Selection of the site for venipuncture varies with the age of the client and the viability of the client's vasculature. You'll choose a vein that is soft and resilient, that is, bouncy when you release your palpation pressure. You will avoid collecting blood from a vein that is very firm or knotty, and you'll avoid sites that are edematous, painful, or scarred, or have hematomas. Also, you wouldn't choose an arm that has an intravenous line in place, has an arteriovenous fistula, or vascular graft, or is in the same site as a mastectomy. Now let's go ahead and demonstrate collecting a blood sample from an adult client. We'll assume the nurse has checked the provider's order, has confirmed the client's identity, and has explained the procedure to the client. Next, the nurse gathers the materials she will need for the venipuncture. She prepares a venipuncture kit and blood specimen tubes, or antiseptic pads, an evacuated collection tube system, sterile cotton or gauze, a tourniquet, gloves, an adhesive bandage, and specimen tubes. She washes her hands, then helps the client into a point in which she can easily assess the venipuncture site. For a client who is in bed, it is helpful to raise the bed if the nurse will stand for the venipuncture. She opens the packages, attaching the needle to the evacuated tube holder. She then applies the tourniquet above the planned insertion site and checks for a palpable pulse distal to the tourniquet. The nurse then selects the vein and palpates it to be certain it doesn't roll or move away too readily. She then releases the tourniquet and prepares the venipuncture site with the antiseptic according to the institution's protocols. She reapplies the tourniquet within 3 minutes of preparing the site. Next, she applies gloves and removes the cap from the needle. Stabilizing the vessel with her non-dominant hand, she pulls the skin at the site taut with her thumb. With her dominant hand, she holds the needle at a 30-degree angle or less, and with the bevel up. She punctures the skin at the straightest portion of the vein with a steady, smooth movement of the needle, and then observes for a flashback or blood at the hub of the needle. Then she firmly pushes the evacuated collection tube through the tube holder so that its stopper is punctured by the distal end of the needle. As soon as blood flows into the collection tube, the nurse releases the tourniquet. After the required amount of blood is collected and the evacuated tube is removed, she holds a sterile gauze sponge or cotton ball over the site and withdraws the needle gently at the same angle it was inserted. She applies pressure to the puncture site for 2 to 3 minutes. When she is sure bleeding has stopped, she applies an adhesive bandage to the venipuncture site, then prepares the specimens for the laboratory according to the institution's protocols. After you complete the blood collection procedure, make sure that the client is comfortable and lower the bed. Then wash your hands and document the procedure and that the blood samples were sent to the laboratory. And now for a few precautions for older clients. Venipuncture presents unique challenges when the client is an older adult. The skin and veins become fragile with advancing age, so you want to minimize injury by using the smallest needle possible. You might not even need a tourniquet because rising venous pressure can overstretch a fragile vein easily, and even a thin needle can rupture the vein's wall. If you need to use a tourniquet, apply it over clothing to reduce the risk of shearing the skin. Stabilize the vein by applying a traction below the insertion site and use a small angle of insertion, 5 to 15 degrees only. Even with these precautions, however, hematomas are common with older clients. Venipuncture takes practice and can be difficult when the client is very ill. In some institutions, phlebotomists collect most blood specimens, while in others, it is the nurse's responsibility. In teaching hospitals, it might be the medical student and interns who do a good deal of specimen collection. Nevertheless, this is a skill that nurses should become comfortable with and should take every opportunity to develop.